What is gallbladder removal surgery?
First of all, I want to define what is gallbladder. Gallbladder is an organ near the liver. The function of the gallbladder is mostly storage of the bile, which is produced by the liver. Sometimes some gallstones or other problems may occur in gallbladder. The gallbladder removal surgery mostly performed for solving the problems according to the gallstones, and in this surgery the gallbladder is completely removed from the body.
Why is gallbladder removal surgery necessary?
The most common reason is the gallstones occurred in the gallbladder. When a gallstone occurred around 10%, it can be symptomatic. The symptomatic patients with gallstones are the candidates for gallbladder removal surgery. Sometimes asymptomatic patients may also be candidates, but we should discuss the pros and cons of the surgery or not having surgery together with the patients, and then we should decide treatment methods in asymptomatic patients. But in symptomatic patients, if we don't perform gallbladder removal, more serious problems like cholecystitis, pancreatitis, and also common bile duct obstructions may occur according to the gallstones.
How is gallbladder removal surgery performed?
Gallbladder removal surgery is a laparoscopic surgical technique. In this method, we use 4 trocars on the abdominal wall and we insert a camera. We focus on the gallbladder. First, we close the vessel and the canal, the bile duct of the gallbladder, and then we take it out from the liver surface and we take the gallbladder out of the abdominal cavity and we finish the surgery.
Will patient experience digestive changes after surgery?
In the beginning, yes, but it will not be a long-term digestive change because in the first 2-3 weeks we advise them to have light foods, but after that, when the body adaptation occurred, they can eat everything.
Can patient live normally without a gallbladder?
Yes, as I mentioned, the role of the gallbladder is the storage, not producing of the bile, because bile is produced by the liver and there is always a flow from the liver to the intestine, a bile flow I mean. But actually in the main meal times, the gallbladder empties the bile that's stored inside it and it helps the digestion. By removing the gallbladder, due to the continuing of the bile flow from the liver, there will be no problem. After a 1 or 2 months adaptation period, all the digestion system may go on their work same as before the surgery.
What are the potential risks and complications?
Actually, we can say that very rarely bleeding may occur after the surgery. The rate is around 1%, and also very rarely, sometimes bile duct injuries may occur during the surgery. For that reason, experience is very important. Mostly, the bile duct injuries are according to the surgical skill of the surgeon, and also the anesthesia related problems can be said as a complication or risk category. The rates are very low, less than 1%, and also the rate of bile duct injury is around 0.1%.
How long does the procedure take?
The procedure is around 30 minutes in normally.
Can gallstones return after surgery?
In gallbladder removal surgery, the gallbladder is removed and there is no gallbladder and there is no gallstone. But very rarely after gallbladder removal surgery, the bile duct stones may occur also. It's a very, very rare condition for the patients. If there is no symptoms, there is no need to follow up for a new stone. But if something symptomatic, a new ultrasonography or other radiological methods should be done in the long term, and discussing these symptoms with a surgeon is also recommended for the patients.